and almost every 3 to 4 months she would get a prolonged GPCS. And then later she started with very disabling kind of jerks, myoclonic jerks, which were interfering with the movements. And these actually did not respond much to the so many of anti-epileptics being given. And this was just a short summary of her journey till in the last 5 years before she came to us. So she was initially thought to have a focal epilepsy, and then tried on narrow spectrum drugs, then a lot of broad spectrum drugs.
Let's start off. So our patient is a 14-year-old girl who's previously healthy, who presents with new onset confused speech and generalized tonic-clonic seizures. She had 3 seizures in a row. The first was at home, the second in the ambulance on the way to the hospital, and the third in the emergency room. Pertinent history is that there was a 5-day history of reduced energy, increased sleepiness, loss of appetite, abnormal taste and smell. There were no infectious symptoms, no fever, no known substance ingestion, and no recent...
She was born to first cousins, a normal pregnancy, but she had a difficult delivery, and she had to spend the first 3 days of life in NICU, but did not need mechanical ventilation. She was first presented at 6 months of age, and her first notes remarked that she had poor head control, she had marked truncal hypotonia, she had some limb anti-gravity movements.
This is a 7-year-old girl. At the time, she presented to healthcare with some progressive changes. So starting at the age of 3, she started having difficulties with her gait. And what parents said was that she was turning her toes in and walking on her toes. This became worse. And by the age of 7, she was given a diagnosis of spastic cerebral palsy.